Hi, everyone. Thanks so much for joining us today for our Active Learning in Psychiatric Mental Health Nursing webinar. My name is Lauren McNeil, and I'm on the marketing team here at F.A. Davis Company. And joining us today, we also have Lyra Salmon, who is also on the marketing team. So before we jump in, I do want to mention a few housekeeping items. Everyone on the call is muted so that you have the best sound possible. But if you have any questions or comments throughout the presentation, you can ask those in the Q&A panel, which is at the bottom right-hand corner of your screen. We're also going to have a survey that follows the event. If you'd like a complimentary copy or if you're interested in reviewing some of the online resources, that's where we can get you set up with those things. So make sure to fill that out at the end. So let's jump in and let's get started. So we're really excited to have you here today to talk about our two psych mental health books, one of which just published this month, along with their accompanying online resources, which are really great to save you time and create that active classroom. So like you can see on the screen, our psych solution really follows a learn, apply, and assess continuum. We have our two best-selling texts, the more comprehensive Psychiatric Mental Health Nursing, the 9th edition that just came out this October. That's the blue teal book. We call it Big T here. And then we have our Practice-Oriented Essentials of Psychiatric Mental Health Nursing book, edition 7, which is that pink purple book on the screen. So included with both texts for free, you have Davis Edge, which is our online adaptive quizzing program, and Davis Plus, which is full of interactive clinical scenarios and teaching resources like lesson plans and active instructor guides. And we're going to be talking a little bit more in detail about each component. So before we jump in, I'd like to know what you feel is your greatest challenge in teaching psych, so we can make sure we're addressing these on the call. So you can write those in the chat panel or the Q&A panel, and I'll give you all a minute to find those panels, but just let us know what you feel is your greatest challenge when you're teaching psych and that you have with your students. So I'll give you all a few moments. All right, it looks like we have a few responses coming in. Time and clinical setting, that's both huge things that we hear from instructors. Short course, another focus on time. Hard time knowing if students are really getting the information. That's another big thing we hear from psych instructors. So thank you so much for writing in. We just love to highlight, that everyone is dealing with struggles in their course, and a lot of these go across the curriculum. They go across all the ways that instructors are teaching psych, especially the need to save time and not having enough time to cover all the material in a short course, and making sure that students get that clinical time that is oftentimes hard to get in their psych courses. So these are all really valid challenges. And like I said, we hear these quite often from instructors. And these are really the key challenges that we were working with to address with the new editions of our Essentials and our more comprehensive text, Big T. So Mary Townsend has always worked to create student-friendly and well-written texts, and they've really provided that core content that students need to know to master psych. The interactive clinical scenarios that we have on Davis Plus were really built and designed to help students apply the concepts that they're learning about in the text to a clinical situation. So it gives them an abundance of virtual clinical time and lets them meet with patients with disorders that they're reading about in their text. But still, we felt like we could do a bit more to address your challenges. The amount of material, writing those test questions, not enough time. So this led us to the two elements that are focused on building with these new additions. So first, helping you to save time with lesson plans and guides to suggest the activities and quizzes to assign to students. And second, Davis Edge, which is our online quizzing program, and it gives you, the instructor, the real-time analytics to assess student comprehension and to know where to focus your time. So Edge was really designed to help instructors take the vital signs of their students' performance, monitoring their comprehension, their participation, and their test-taking skills. We wanted Davis Edge to further develop the effectiveness of our two psych texts on the screen here. And we have our text providing the content needed to learn course material, and then Edge comes in to provide the tools to evaluate that student understanding. So today we're going to dive in and talk a little bit more about these three components: learning, applying, and assessing, and show you how these can really be used together to ensure student mastery in a psych course, especially in a shortened psych course. So let's start now with the learning component. So as many of you already know, Mary Townsend is the founding author of our psych textbooks. She's extremely well respected in the educational community and is truly a gifted writer. So in addition to the two texts you see on the screen, she also wrote the Pocket Guide, Psychiatric Nursing, Assessments, Care Plans, and Medications, which we'll publish in January of 2018 with updated NANDA guidelines. And that includes the diagnostic information needed to create a care plan and covers the safe prescription and administration of psychotropic medications. And we're really excited to introduce you to Karen Morgan. And Karen teaches courses at the University of Akron of Nursing in Ohio, and she works as a professional consultant at the National Alliance for Mental Illness in Summit County, Ohio. She was handpicked and mentored by Mary Townsend to join her on this text, and she really has a similar writing style to Mary and brings a fresh eye to how we can really continue to make the psych course engaging for your students. So you may be familiar with one or both of these titles, but let's touch on how these titles compare and contrast. So Psychiatric Mental Health Nursing, or Big T, the Teal book, is grounded in the theoretical concept of stress adaptation. Big T devotes full chapters covering therapeutic approaches and interventions and has a more narrative style that focuses on the how and the why behind specific nursing actions. Comparatively, the Essentials book, the Pink book, is designed for a shorter course. It focuses on that need-to-know information, and it really spends more time emphasizing practical application of what to do. And we know that time is one of the greatest challenges for psych instructors, trying to fit in all the necessary content into your allotted course. So we have Big T, that's designed for a longer course, and Essentials, that's designed for a shorter course. That being said, there are many similarities between the two titles in terms of the online learning and the teaching resources that come with each text that are similar in scale, but the content included is specific to the given text. We also include similar pedagogical features in both of these texts and hot-button topic areas. So let's take a look at some of the ways these two titles are familiar with the features they have. So the first thing that we're going to talk about, and this is included in both the Bigger Townsend book and the Essentials Townsend book, are the care plans. And care plans are presented in both texts. In the bigger book, it's more of a narrative format, and then in Essentials, you have a more boxed version. And these are so important for students to see as they're learning what needs to be considered for a specific patient. Knowing that students may be even more nervous about caring for a patient diagnosed with a psychiatric disorder, we've included an icon that you can see on the screen here that includes specific communication tips and interventions of the care plans. So these are things to say or body languages, suggestions to help that student feel more confident and prepared going into meeting with a patient diagnosed with a psychiatric disorder. So next, still on the topic of communication, and this is also included in both the Bigger Townsend book and the Essentials, this is another communication exercise. So, like I mentioned, students, as we know, are a bit more nervous to speak with patients with psychiatric disorders. So we want to give them as much practice as we can. So we include these communication exercises to work through and help students learn the appropriate response in a situation meeting with a patient. And this next feature that we're going to go over, this is a new feature that our author, Karen Morgan, actually brought to the text. And this is probably my favorite feature that we have in the Townsend series. So this is the Real People, Real Stories box, and they provide interviews with clients suffering from the disorder focused in the chapter. So in this example on the screen, this is from the schizophrenia chapter. So it's really a chance to hear the client's voice in his or her own words and models how a nurse should communicate with a client and respond to the things that they're talking about. So it's a really good way to apply those communication exercises to real-life experience. Another feature that we have across both the larger text and the Essentials text are the DSM-5 boxes. And when the DSM-5 published in May of 2013, our text was really the first title on the market that was updated to include all of the DSM-5 diagnostic criteria boxes to make sure that your students always had the most up-to-date terminology and understanding to answer questions about this content on the NCLEX. So now that we've covered some of the specific features that you'll see across both texts, I want to talk a little bit about what is new in each of the books. So the new content in this 9th edition of Psychiatric Mental Health Nursing, the larger book, we have a new chapter on psychopharmacology, as well as FDA-approved drug information integrated through relevant disorders chapters. And we've also revised several chapters, including issues related to human sexuality and gender dysphoria, and cultural and spiritual concepts relevant to psychiatric mental health nursing. In the smaller Essentials book, we've included an entirely new chapter on suicide prevention that also includes communication exercises, a new chapter on psychopharmacology, and completely revised chapters on issues related to human sexuality and gender dysphoria, and cultural and spiritual concepts relevant to psychiatric mental health nursing. So really, we want to make sure that we're keeping this text on the cutting edge in terms of the content you need to make sure that your students are succeeding. Each new print book includes access to a free ebook, or if your students prefer, students can also access this content fully digitally. They can use their ebook and all of their resources online. And our ebook really tends to be one of the most popular resources with instructors and students that comes free with the book. So now that I've gone over the both books that we have to offer, the differences and similarities between them and what comes new with each edition, I want to pass things over to Lyra so that she can talk to us about the applying portion and all of the resources available to you on Davis Plus.
Great. Thank you so much, Lauren. So I'm going to go over Davis Plus for you guys, and this part is really exciting because we've done a complete organizational rehaul and reboot of the instructor and student resources on Davis Plus with the concept of integration in mind. So we worked with Karen Morgan and experts in the field to kind of reformulate the instructor resources in two ways. One was based off usage data, which kind of just refers to what resources you as instructors were using the most, preferred to use most often, and second, how the different pieces work together in this learning, applying, and assessing model that we mentioned earlier. So we created two new resources that speak to our applying portion. First, the Active Classroom Instructor Guide and the Active Classroom lesson plans feed into this idea of having an active classroom and using these resources to bring the classroom to life. We know how much instructors work to try to amplify their students' learning experience, and we want to make that process even easier for you all. And nobody wants to stand and lecture through an entire class, so we want to play on the idea of having a more immersive learning experience, and we want to help you guys make that classroom more interactive. So this context has been missing from some of our ancillary program previously, and it was a significant focus of this edition. So the instructor guide is really the key. It's going to give you the content of how to use the lesson plans you're going to be provided with, which include suggestions and teaching tips on how to incorporate EDGE into your classroom. There's a new section of how to use the clinical tools that are really perfect to give your students prior to clinical, or if you have an instructor who is new to teaching psych. And the lesson plans are organized by before, during, and after class. So, for example, before class, you'll have homework assignments in the text that check to see if your students have read. For during the class, this is where we've included suggestions of activities that you can have your students complete, or case studies that you can have your students discuss during class, or interactive clinical scenarios that students can work through. After class, that's when the students have completed their reading, applied what they've learned in the text and in class, and this is when we get to to the assessment component, and we'll come to that shortly. We've also added a clinical toolkit with forms, assessment tools, and references you can share with your students prior to clinical rotations, which, for example, include electronic test banks and resource kits as well. So the next thing I'm going to go over is our interactive clinical scenarios, which Lauren kind of touched upon a little bit beforehand. So these are one of our most popular resources for students, and it's really the perfect component for that active classroom, because so often we hear that it's difficult for students to get clinical time during their psych rotation. So they aren't always as comfortable with patients who have various psychiatric disorders. So one of the ways we try to help students feel more comfortable in that sense is to kind of give them a simulated clinical experience through our ICSs. So these scenarios span the psych curriculum, and they not only engage the student but encourage them to work all the way through the scenario using those steps of the nursing process until they get the correct answer. So I'm going to quickly go through one of these for us so we can kind of get a quick overview. So I'm going to use the schizophrenia ICS as an example here. And the first thing I'm directed to is a client-patient summary, which includes patient interviews and charts. And on the left-hand side of the screen, you're going to see the steps of the nursing process that the students will have to work through in this particular scenario here. So students are able to click through the scenario just like they would encounter a scenario in clinical, and the program includes rationales to help students understand why they got something right or why they got it wrong. So we're going to walk through this scenario here right now. So in this activity, this is a clustering activity, and the students are provided with assessment data that would have been collected after the assessment items chosen previously were performed. So the student right now is going to be tasked with sorting the data into clusters or groups. Each assessment data piece can belong to one cluster only. So this activity is really great for students to understand how to actually apply that given assessment information. And then moving right along here, now that I've clustered those assessment items, I can check to see if they are correct with the full rationales right here, so that the students can understand why the option is correct or incorrect, and they can really comprehend the reasoning behind that, correct or incorrect answer. And next, we come along to the evaluating outcomes, which is the final step of the ICS, and it acts as an overall review of the interventions provided to that patient. So instead of actively choosing items, the student is going to be provided with a list of the outcomes and interventions that are related to their patient, and then the best possible result from those. So this page, again, acts as the ICS wrap-up. And this was just kind of a short overview. We didn't have time to go through the whole thing today, but it was a short overview of what one of our ICSs will look like. And just remember, for all of our psych techs, we have over 15 ICSs for your students to really get them acclimated to a variety of patients and give them that clinical experience across the curriculum. It's a really great resource to help students learn how to communicate with patients safely and effectively. And before we move on to the applying portion, I wanted to quickly go over EHR Tutor, which some of you might be familiar with already. And I'm sure if you're not familiar with EHR Tutor, maybe you're using another EHR in your class or in your sim lab. Or maybe you're looking to bring one in to your course. And many instructors that we've spoken to typically use an EHR in their sim lab, but they don't necessarily always bring it into the classroom. And that's something that we have found with our partnership with EHR Tutor to really be beneficial. And we've found that it's incredibly useful and can really enhance the psych course once you're able to see how it can connect with the textbook. And we're incredibly excited about this new partnership with EHR Tutor, being able to provide you guys with a really easy to use, it's customizable customizable. It's also very affordable for your students, this electronic charting solution that we're really excited about working with our textbooks. And it can be used to support learning in the classroom, in the sim lab like we talked about, and also in clinical rotation. So just as a quick overview, like let's say you've assigned Chapter 24, schizophrenia spectrum and other psychotic disorders. Remember these case studies that the students are exposed to as they read through the chapter, and now they're in class. So you can use EHR Tutor to really enhance the engagement and bring that case study to life by going in virtually to visit that patient in the hospital with schizophrenia. You can use the patient charts to illustrate the concept of schizophrenia and the key points from that case study. So for example, you can pull up Peter Snyder's chart in EHR Tutor who is diagnosed as a paranoid schizophrenic. You can evaluate his meds, you can walk through his assessment, and then you can continue on through the diagnosis. You can ask your students questions about what they're seeing on the chart and ask them how they're going to prioritize care for their patient. Using the patient charts is a really effective way to give your students exposure to clinical experience on the fly, also that practice with electronic charting that they need, and by really meeting a specific patient, they can make a tighter connection and learn how to start thinking critically like a nurse. So we've also taken steps to make this connection even easier for you by creating these maps that essentially provides suggested patient charts in EHR Tutor that align with the content of the textbook to really help make that integration of that content a lot easier to see which patients you should be using as an example. So we don't have time to go through a full walkthrough of EHR Tutor today, but if you're interested in learning more about EHR Tutor, let us know in that final survey or even in the Q&A, and we'll get you set up with a private walkthrough so you can learn more about the student and instructor functionality for your course. And with that little overview, I'm going to pass things over to Lauren.
All right, great. Thanks so much, Lyra, for covering that applying portion of our continuum. And we're going to keep moving and talk about Davis Edge, which completes our continuum as the assessing component. So Davis Edge provides adaptive quizzing for your students in order to master their course content in psych, improve their scores on classroom exams, and prepare for the NCLEX. And for you, the instructor, Davis Edge provides the tools to continuously take the pulse of your students throughout the course to know where to focus your time, where your students are succeeding, and where they're struggling. So in Davis Edge, you'll receive real-time information to monitor their comprehension, how well are your students understanding the content in psych, participation, are they keeping up with the depth of content, and test-taking skills. Are they adapting to NCLEX-style questions and preparing for that psych content that will appear on their exams and on the NCLEX? So using Davis Edge, you don't have to wait until after an exam to find out which students are struggling. You'll really know who's having trouble and be able to quickly intervene with our assessment tools. And I'm sure many of you are familiar with adaptive Q&A products. So the two items that really set us apart are high-quality questions at the application and analysis level, and comprehensive rationales for both correct and incorrect answer options. So we want to make sure that every moment is a learning moment to remediate and reiterate the content that you go over in class. So let's go ahead and take a look at what Davis Edge looks like. So because Davis Edge covers the topics and concepts in the textbook, it's easy to create assignments that target your readings and what students are learning in class, allowing you to assess their comprehension. So as you can see, you're able to create assignments based on topics or concepts, or a really exciting part that we built into the Townsend Davis Edge model are preset assignments. And this really goes hand in hand with the textbook chapters. So we have options for instructors who want to roll up their sleeves and really select what types of questions their students are getting and really handpick the questions. And then we also have the preset assignments. If you're someone who's already bogged down, doesn't have a lot of time in your psych course, we have preset assignments designed for every chapter. So we want to make sure this is flexible for the type of learning that you're doing in your classroom. So we also have the option to select from a private stock of instructor-only questions at the bottom of the screen. So if you check this box, these questions are only available to you, the instructor. Your students will never see them, and these are a great stock to know that you're the only one seeing them and you can assign these as an exam. So next we want to look at the Success Center for instructors. And this is where you can see those real-time reports to monitor and track student progress and time spent in the program. So within the Success Center, you're able to do a couple of things. At the top of the screen, you'll see the average assignment score, the average assignment time, and the average assignment participation. You're also able to, there we go, I was just making sure that was still on the screen there. You're also able to create assignments right from this screen, check your grade book, see how your students are doing both individually and on the class level. So this is really your hub. This is where you want to be when you log into Davis Edge to see your at-risk students, your top students, how they're doing individually and how they're doing as a whole. So let's go ahead and take a look at what creating an assignment looks like. And let's switch gears and talk a little bit more about the student experience. So you saw what the Success Center looks like for instructors. And this green graph here on the screen, this is what your Success Center will look like for students. So just like you have, they have a really nice visual snapshot of how they're doing. They can see their strengths and weaknesses. They can see their time spent in the program, their average score, and their success levels. So it's a really nice way to see how they're doing, what they need to improve on, and areas that they're already doing well in. What's also nice is that students have the ability to create their own practice quizzes to help improve those areas of weakness. So not only do you have the assignments that you've created, but if a student knows that they're not doing particularly well with the schizophrenia chapter, they can go ahead and take practice quizzes specifically focused on schizophrenia. If they know that they're having trouble with the select all that apply questions, they can go in and create a quiz with just select all that apply questions. So if a student only has, a few minutes between class, or they're commuting to school in the morning, they can go onto their phone or their tablet and take a quick 5-question quiz in Davis Edge while walking to class or preparing for class. And all of this data is fed back to you. So you can see which students are completing work outside of the class and which areas they're spending some more time in. So if you know that a student is struggling with a particular area, you can go ahead and see in Davis Edge if they're taking those extra quizzes, how they're doing on the assignments, to really give you all of that information and take a pulse on the course. So like this question on the screen here, we talked a little bit about those select all that apply questions. We know that students need those challenging questions focusing on application and analysis to help them learn at a higher cognitive level, and that's why we presented so many high-quality questions. Davis Edge includes both traditional multiple choice as well as alternate format questions. We have about over 20%, such as the select all that apply on the screen. And we know that these questions often draw the most anxiety. So we want to make sure that students are getting ample time to practice with these questions. So after a student has taken their questions and gone through their quiz in Davis Edge, what they'll see is a feedback screen, no matter if they're taking an assignment that you've created or they're taking an assignment on their own. And the feedback screen shows your students how they performed on the assignment. So comprehensive rationales are given for both correct and incorrect answer options, and we encourage students to read through the rationales, even if they answer the question correctly, to understand why they answered it correctly. And then select questions also include test-taking tips. So those are really built in to help students understand how to approach the question. They can deal with the ABCs or Maslow's hierarchy of needs to help them eliminate answer options and get more comfortable taking these types of questions. What's really nice, too, is that page numbers are also listed so that students can easily tie the question back to where a topic is covered if they need a little bit more detail in the book. So now that we've walked through the 2 psych texts that we have to offer, the Davis Plus resources with the interactive clinical scenarios, as well as the Davis Edge component, that's really how we designed our continuum, to cover the learning, the applying, and the assessing, to save you time in class and also ensure that mastery of content. So we know that you may have further questions, or maybe you need a closer walkthrough to see how this would work specifically in your course. So we really appreciate you joining us today. But if you have additional questions, you can contact us at davisedge@fadavis.com, and we'd be happy to follow up with you to get you a complimentary copy of the book, a personal walkthrough, or access to some of these online resources. You can also let us know what you need by filling out the survey that's going to pop up immediately following this event. So we're happy to keep working with you, make sure you have all the resources that you need to make sure that you and your students are succeeding teaching this crucial psych content. So thanks again for joining us, and have a great rest of your afternoon.